am Dr. Colfax, the Director of Health for San Francisco, and I am very grateful to have Mayor Breed here with us today at Code Tenderloin to share last month's overdose numbers and to announce a new treatment program for people who use fentanyl and other opioids, our new 16-hour on-demand buprenorphine access program. And Code Tenderloin is one of our most valuable community partners working to help us save lives from overdose. And I want to thank Code Tenderloin and the incredible team for the work that you do and your partnership with the city. I also want to thank the Office of the Chief Medical Examiner for their partnership and diligent work on the data that we review every month. Now, last month in San Francisco, 41 people unfortunately died of an accidental overdose, according to preliminary report released today by the Office of the Medical Examiner. Now, with these data, we've now had a 20% reduction in overdoses in San Francisco in 2024 compared to this time last year. These data also show a 31% decrease in lives lost this month compared to September of 2023, in which 59 overdose deaths were reported. This is the sixth consecutive month we've seen a monthly decline in overdose deaths from 2023. Now, we hope that this downward trend will continue, and because overdose deaths are as preventable as they are tragic. Here at the Department of Public Health, with community partners like Code Tenderloin, we continue to expand treatment and care for people who use drugs and people who are in recovery for substance use disorders. This year, we are seeing an increase in substance use treatment admissions, including for methadone and buprenorphine treatment for people who use fentanyl, heroin, and other opioids. Now, buprenorphine and methadone are highly effective treatments. They reduce the risk of overdose deaths by as much as 50%. And I can tell you as a clinician, very few drugs are that effective. These are incredible drugs, and we need to ensure that people have access to these medications. Both medications help people manage withdrawal symptoms and cravings and help them recover from addiction. Now, we expect that our upward trend in getting people on treatment will continue with the expansion of our nighttime on-demand buprenorphine pilot to now expanding this program to 16 hours a day, 7 days a week. Our pilot was a success, which is why we are expanding this program. Let me just give you some numbers from our pilot. The national rate of receipt for medications after prescription is only 18%. Our pilot, with our partners at Code Tenderloin, we have a pickup rate of double that, 40%. 40% pickup rate, double the national rate. And when we can provide a place for people to stay when they start their medications, that pickup rate skyrockets to 90%. So that's why we've looked at the data and in partnership with Code Tenderloin and others, we are now offering on-demand buprenorphine 16 hours a day to anyone who wants help. That means from 8 a.m. to midnight in San Francisco, anyone can call a number, speak to a doctor or nurse, and get immediate prescription for buprenorphine. The doctors or nurses are ready, 8 a.m. to midnight, to create an individualized treatment plan and to prescribe you buprenorphine. To our knowledge, this is the first program in the state to make this life-saving treatment so available. This expansion is part of the department's ongoing initiative to make effective treatment for substance use disorder easier to access. Now, it's not just about the 16-hour buprenorphine program. We've also more than tripled the number of health workers who are in the community every day on the streets delivering services to unhoused people who use drugs with the goal of getting them into treatment. We've added more than 70 weekly service hours at treatment centers and access points across the city. We've developed and expanded innovative treatment programs such as contingency management. And we've opened approximately 400 new residential treatment and care beds, including recovery housing for people who need support after exiting residential treatment. And as we speak today, we have residential treatment beds available for people with substance use disorders. We are seeing an increase in treatment and a decrease in overdoses, but we are still seeing too many deaths. This is why we will continue to work every day to make sure that we expand our programs to save more lives. And I'm thankful to Mayor Breed for her leadership, and it's my pleasure to introduce Mayor Breed. Thank you, Mayor.
Dr. Colfax, and thank you all so much for being here. Special shout out to Urban Alchemy for all the great work you guys do. We appreciate the fact that you are here, that you are in this community every day, and that you are also a part of helping to save lives. And it's quite interesting being here today. I will tell you that oftentimes when you're talking about something bad happening, there's a huge number of press that typically show up. And for something like this, which is about life-saving decisions, it's interesting to see that we are very limited in the number of people who show up here. And it's quite frustrating that the kind of attention that this needs, it's not getting. But let somebody do something bad, and all of a sudden you got 20, 30, 40 cameras all over the place looking for a story. Because, you know, I know for many politicians, oftentimes, you know, this is often political. It's about supposedly doing a job and getting some attention, but so many of you know that this is not political for me. This is very personal. It's very personal in the fact that, you know, I have lost a sister to a drug overdose. It's very personal to the fact that I have family members who have consistently struggled with addiction, people that, you know, I have lived with and lived within these circumstances. And so many of you can talk about many personal stories yourselves. So this is not politics. This is personal, and what we are trying to do to combat what has been a crisis all over this country. Fentanyl is like nothing I've ever seen before. And so when I've made decisions as mayor, I went to the people who had the direct experience, people who were former drug dealers, people who were former drug users, to say, what should we do as a city? How are we going to combat this issue? Because the last thing I want is for somebody to lose their life from a drug overdose, especially with what is happening with fentanyl all over this country. You are out there doing the work, seeing it every day. And I am incredibly thankful to Code Tenderloin, because they are in the middle of the night, putting their lives on the line, going out there, offering help, offering support. And I want to appreciate Donna and Dale Seymour and the entire Code Tenderloin team, because when other people are talking about what we're supposed to be doing, you guys are actually out there doing it. When folks are saying, well, if I was this and I would do that and I would do that, you know, Monday morning quarterbacks, but I don't see them walking the streets of the Tenderloin. I don't see them out in the middle of the night in the TLs doing anything for anybody. We have a compassionate group of people that are out there trying to offer folks help, offer them a chance. And if you've ever experienced addiction, you know it's not as simple as an offer. You know it's complicated. You know it's 150 offers. You know it's nonstop. Second, third, fourth, and fifth chances. We cannot let up, because lives are clearly at stake here, differently than they have ever been before. And the folks in this room know that more than anyone else. That's why we're here today, because an effective program that we've been using since March, 4 hours, middle of the night, out there, subscription of buprenorphine. We've seen a 46% increase since last year. We're seeing more people accept our help. We've not only increased our shelter beds and our permanent supportive housing beds, but we're adding more beds for substance use disorder. We have finally gotten serious about abstinence-based treatment as a real public health solution to this crisis. It's not one thing or another. It's not this against that. It's every damn thing that we need to do in order to help save people's lives. And that's why the effectiveness of this program, with the number of people that we are seeing that are saying yes to help, yes to support, taking us up on our offer, and choosing life over death, that means we have to invest in that even more so than ever before. So today, we're going from 4 hours to 16 hours, so that it's on demand for real. It's like right where you are, however we can get you the help and the support that you need. And we could not do this without partners like Code Tenderloin, because they're the ones who understand it more than anyone else. They're the ones who are willing to go out there and have the conversations, the uncomfortable conversations with people who may not even be able to have a conversation. And that's what this is about at the end of the day. It's saving lives. It's helping people get on the right path. It's helping give people second, third, and fourth chances. That's what we have to be able to do. This city has, of course, been known as a city that is, compassionate and supportive and everything else. But at the end of the day, we have to make sure that some tough love is in the equation. That's the part that we are bringing to the table. We can only tolerate so much, but we have to be able to make sure that a solution is at the end of the tunnel, that an opportunity that meets the need of that person and meets them where they are. And that's what today is about, and that's what today represents. So again, I want to thank all of you for being here, all the work that you continue to do to serve this community. Everyone has a lot to say about the TLs right now. Everybody talking about the TLs and this and that. But, at the end of the day, what are they doing for this community? What are they doing to help the families, the businesses, the folks who live here, the people who work here? They're not doing a damn thing. The people who are in this room today, from Urban Alchemy, Code Tenderloin, you all are the ones on the front line doing that work, which is why I appreciate you so much, and why in every single instance when I'm introducing my budgets and the board is trying to make cuts and trying to stop the resources from flowing, I will never stop those resources from flowing, because I know that what you do is a matter of life and death, and I appreciate everything you do every single day to put your lives on the line to help save others. So thank you all so much for being here.
Thank you so much, Mayor Breed. On September 30th, the San Francisco Department of Public Health expanded a pilot program that makes it easier for people to start treatment for opioid use disorder, including fentanyl addiction, 16-hour on-demand buprenorphine access. Now, anyone who lives in San Francisco and is struggling with a fentanyl, heroin, or opioid pill addiction and wants help can call the Behavioral Health Access Line between 8 a.m. and midnight to obtain an immediate prescription to buprenorphine in real time. Buprenorphine prescriptions can be picked up the same day from our Behavioral Health Services pharmacy at the 1380 Howard Street or a local retail pharmacy. Individuals who want to start methadone medication can discuss methadone treatment options and receive help enrolling in a methadone treatment program. Navigation support will also be available for prescription pickups and linkage to ongoing treatment. This service is for people who want help starting medication treatment, need a prescription between care episodes, or are having difficulty connecting to medication treatment for any reason. This program evolved from a nighttime pilot with our partners, Code Tenderloin, where street workers were connecting people in the Tenderloin who wanted treatment with an addiction specialist on the phone for immediate prescription to buprenorphine. The pilot has been hugely successful in helping people who use opioids start medication treatment. Since the pilot launched in March, our night navigators from Code Tenderloin have facilitated telehealth visits with nurses and doctors for more than 1,350 people. As Dr. Colfax said, approximately 40% of those individuals either started buprenorphine or methadone, and some of them have entered residential treatment. When available, we also provide unhoused people starting medication with a bed where they can stay for a week and where they can receive additional support. And as Dr. Colfax said, when we do that, we see prescription receipt go up to nearly 90%. We know that fentanyl is highly addictive and very harmful, and we need to continue to find creative programs and provide flexibility and ease to start treatment and recovery. Someone who has been part of this pilot program and inspires me all the time, Donna Hillard, the Executive Director of Code Tenderloin and Supervisor of the DPH Night Navigation Team, is here. And by meeting people where they're at and in the moment when they're contemplating change, she and her team are providing more opportunities for people to recover from opioid addiction. Recovery is possible for everyone.
Wow, thank you so much, Krista. Thank you for your leadership. Hi, my name is Donna. I've been overseeing the Night Navigation Program since the start in October 2023. Night navigators are out in the community every night until 3 a.m., helping people who use drugs find treatment, Medicare, and social services. We want to thank San Francisco Department of Public Health for starting the on-demand Butte pilot in March based on our feedback that there was a demand for this type of care. Not only did they say, yes, we'll start it, but they listened to the solutions we had and how we could work around and come up with unique solutions, okay? So thank you so much, because no collaboration works if both people don't come to the table. And so I'm really excited to see Urban Alchemy here in the house tonight. So thank you, because a lot of people don't realize Urban Alchemy and Code Tenderloin, we are together. People think that all these ambassador teams out here are against each other. No, we are the community. We are serving our Black and brown folks out there on the street, and everyone with love and care. And so to see you here in the house supporting us today, thank you. The people we talk to on the streets are primary San Francisco residents, many of whom have never stepped foot in a hospital, clinic, or treatment center. Think about that for a minute. We have a lot of people suffering on the street and they've never went to get care. They are often experiencing homelessness, dealing with multiple issues, including mental illness, addiction, and trauma. These are barriers that make seeking traditional medical care feel nearly impossible. Some have been hesitant, scared, and many have just had bad experiences in the past. And I think a lot of the people in this room can understand that, right? Or just scared of the unknown, what making that next step looks like. So the on-demand Butte pilot has shown that reducing barriers to treatment, increasing the chances that individuals will take the crucial first step to recovery. We are bringing care directly to them in a way that's easy, compassionate, and without judgment. And the response is freaking overwhelming. People are astonished that help is really readily available and that they're deeply grateful. Many seize the opportunity to make a change, and sometimes for most of them, it's the first time in many years they've even thought about it. For more than 7 months, our team has been in the Tenderloin every night offering telehealth visits that connect individuals to medical providers to get them started on medication treatment. Yet even today, we continue to meet new people, and we're surprised because they've said no one had talked to them. How could that be possible? You've been in the Tenderloin for 10 years, and you've never talked to a medical provider or anyone for help. We want to change that. For example, with buprenorphine, people can start with a microdosing plan or opt for a monthly injectable treatment. The level of choice empowers them to take control of their recovery in a way that works best for them. But change is hard. Human nature is what it is, right? We delay to make decisions sometimes, put off change until tomorrow, next week, or next year. Of course, not everyone will pick up their prescription right away. Some people may not even return for a refill. But for others, this is the moment when things shift, when they finally decide to break the cycle. This is their first step to the road to recovery. For us, helping people take those first steps is an incredible honor. We see their courage, struggles, and hope. Witnessing these moments transformation is like deeply moving, and we see it every day, right? So we know that recovery is possible. And I'm going to tell you a little story about something that happened to us a couple weeks ago. We were out on the ground and we had a guy come up to us and he like ran up, hey, you don't remember me, you don't remember me. And so I was like telling my team, come here, do you remember him, right? And so he whipped out his cell phone and he said, you guys helped my friend, my girlfriend, she's pregnant. She's had the baby and she's clean and sober. He pulled out his phone and showed us pictures of that newborn baby. And when I tell you at that moment, tears just started falling of joy. He said, I'm a proud father and I'm ready today to go to treatment because I want to be with my family. So the reason why I tell that story is because we're not just helping one person, but it's a ripple effect. We're helping a whole family. For that family, they're now going to be together and they're both on their way to a brighter future, and also for that child. So this is why we do this work. And we're committed to doing this work, and we're committed to train others to do this work because we know we can't do this work alone. We do this in unity with everyone else. I'd just like to give a shout out to the whole Code Tenderloin team because a lot of us don't get much sleep these days. So shout out to the heroes. Thank you everyone that's on the team.
We have a couple other